My name's Jordan McCann. I'm with Columbus State University, and this is my Capstone Senior Project. Patient falls in the acute care setting. The abstract. This project will show the correlation between nurse rounding and hourly rounding and inpatient falls. Data will be provided to further prove that hourly rounding reduces the number of inpatient falls in the healthcare setting. Specific actions will be suggested to implement an hourly rounding protocol in the acute care setting. Hospital falls. As healthcare professionals, we took an oath to do no harm and provide safety. The Joint Commission continues to acknowledge that patient falls in the acute care setting are a large patient safety problem the healthcare industry continues to deal with. Not only does a patient fall put them at risk for injury, but also creates a large financial obligation for hospitals. This is why it is so important for healthcare facilities to continue to implement changes in current practice in order to promote safety. While we as healthcare professionals may not be able to completely prevent every fall because of the complexity of issues associated with falls and challenges in assessing every patient individually, we are able to significantly reduce preventable falls with evidence-based ideas. What is the problem? What is a fall? The World Health Organization defines a fall as an event in which results in a person coming to rest inadvertently on the ground or floor or other lower level. Why is the patient falling such a big deal? When a patient falls, this not only causes potential for harm, but also the increase in cost for the healthcare facility and an average 6.3-day extended hospital stay. It is said that 30 to 50% of hospital falls result in injury, and with each injury, an added cost of $14,000. It is also said that the Centers for Medicare and Medicaid do not pay hospitals for the patient who has fallen. All of these are driving forces to change. I hope that in giving this presentation, the audience will be able to understand the seriousness of what an inpatient fall entails. Also, that they are able to understand and demonstrate compliance in hourly rounding in order to reduce patient falls in the acute care setting. I hope that by giving this presentation, enough information can be taken from this and allow for the audience to implement hourly rounding as they see fit. The rationale. Hospital falls are a recurring problem in the healthcare industry. Finding a solution to this is imperative in order to promote patient safety and reduce harm. Not only will this promote patient safety, but this will also cut healthcare expenses. The causes of inpatient falls are vast. However, generalizing these causes will allow us to hit some of the main causes, like patient acuity or the lack of time, the environment, communication, culture, the patient's deconditioning, and medications. So this is the research question. In the acute care setting, how does hourly rounding in comparison to regular nurse rounding affect inpatient fall rates? The evidence. Hourly rounding replication study. This evidence was a quasi-experimental study. The site was a 506-bed hospital. They used 2 medical surgical units that were mainly based on the significant fall rates. The study suggests that hourly rounding significantly improves fall rates. Out of all 3 of these, this was the one that showed the least percentage in fall reduction. However, results were still seen to be an improvement. This study showed a decrease by 23%. The effects of hourly rounding showed the positive benefits to the process. Hourly rounding and patient falls, what factors boost success? This research article reviews a pilot study. The study consisted of 2 medical units at a 907-bed hospital. The implementation of hourly rounding intervention with the active participation of leadership and staff nurses showed the significant reduction in fall rates on the medical unit. Prior to the implementation implementation of the hourly rounding. Fall rates were noted at 3.9 calls per 1,000 patient days. The pilot period fall rate was noted at 1.3 per 1,000 patient days. This is significant change. This data also showed that when leadership was not involved, hourly rounding then became not an effective form of fall prevention. Can rounding reduce patient falls in the acute care? An integrative literature review. This review method was used to review results of other studies to correlate a reduction in fall rates with the implementation of hourly rounding. 14 scholarly articles were included. These 14 research articles showed the correlation between hourly rounding and the decrease in patient falls. In fact, many of these articles showed a decrease in patient falls up to 50%. The results of the 14 scholarly article reviews showed the positive effects of hourly rounding in correlation to reducing the number of patient falls in the acute care setting. Hourly rounding. Hourly rounding is the purposeful check-in on patients using clock intervals to predict their needs in order to reduce falls. Patients will be seen and checked in every hour by nursing personnel. Day shift nurses will conduct hourly rounding from 6 to 10, and night shift will conduct bi-hourly rounding from 10 until 6. Effective hourly rounding will include specific tasks and certain scripts by relying on the 4 Ps: pain, position, potty, and possessions. Pain is when you're assessing that patient's pain at the time of the round. Position is saying specific words such as, are you comfortable in this position, or can I make you more comfortable? Potty would be like, while I am here and available, may I assist you to the restroom? And possessions is the nurse and nursing personnel assessment of the patient's environment. Hourly rounding begins with the introduction of the oncoming staff and the explanation of this process. Specific key phrases such as, before I leave, is there anything else I can help you with? Or, someone will be back in an hour to conduct the hourly round. An emphasis on high quality care should not be excluded from this process. The use of whiteboards in the patient's room also addresses the patient's plan of care, nurse's personal phone number, and other imperative data related to the patient's plan for the day. Rounding logs will be located on the inside of every patient's room next to the whiteboard. The staff will log each time they are in a patient's room and if they have addressed the 4 Ps. Each specific P allows for the nurse to predict the patient's next need, thus reducing the risk of falls, increasing patient satisfaction, and reducing the use of call bells. Lewin's change theory lists 3 stages in order to make a change. These steps will help in addressing all key points in implementing the hourly rounding process. Unfreezing, which is the measures taken before the implementation of the plan, to the change, which is the actual change, and then freezing is how are we going to make it stay. You also have the driving forces, which are why do we want to make this change, and you have your resistance forces, which are what are the problems that can come about while making this change. Unfreezing. In order to motivate and encourage staff members to open up about the hourly rounding process, a staff meeting will be held in order to show data and research on how hourly rounding and how this will benefit them. Ample time will be given in order for staff to project ideas, concerns, or questions they have about this process. Keeping in mind, the staff will be the sole part of this new process. Staff will be included in all aspects to the new change. Open-ended communication and solution-focused communication is also imperative in order to move forward. Change. In order to implement this quality improvement initiative, in-depth education to staff members on the policy must be provided. This education will include how hourly rounding is done, why we are implementing this method, the data to back the claim, and the expectations of the project. A handout will be given that provides a checklist of key elements words to use during the hourly rounding. A demonstration will be provided, and the teach-back method will be used in order to validate the education. On this checklist, 4 key components are used. These components are known as pain, potty, positioning, and possessions. Within these components are key phrases that must be said in order to comply with this method. These components must be recited every hour. Leadership rounding will occur daily on every patient to address needs, concerns, and validate compliance with the hourly rounding. Freezing. In order for positive results, remember that the ideas from staff should have been included in this project. Education will be given periodically to reinforce this change. Validation from management will be done quarterly to ensure competency in this process. And statistical data pertinent to the unit on fall rates will be handed out quarterly to show progression with the new implementation. My project will be evaluated through leadership rounding. Leadership rounding occurs daily on every patient. Key questions are asked during these rounds that allows for the collection of data on the compliance of hourly rounding and its effectiveness. Staff validation will occur quarterly to ensure that they are properly demonstrating the hourly rounding process. Management completes the staff's validation. Rounding logs are to be picked up every day and data will be collected from the logs. If the patient unfortunately does experience a fall, a debriefing tool with specific questions related to hourly rounding will be asked. The purpose of all these variables that aid in the collection of data is to correlate hourly rounding and the reduction of inpatient falls. Lastly, discharge surveys will be completed to evaluate the patient's perception of hourly rounding and the staff's compliance. Like the quarterly staff validation, the hourly rounding data will be reviewed quarterly to monitor the effectiveness and compliance. The process for education and implementation of this quality improvement evidence-based research initiative may take up to 5 months from beginning to end in order to properly initiate the project. Expected outcomes. With any change will come some challenges, so I expect to see a few challenges with implementation. I expect to see challenges in compliance among staff in the beginning. But most importantly, staff will understand the importance of hourly rounding on the reduction of inpatient falls. I also expect to see an increase in responsiveness and patient satisfaction. In conclusion, after the implementation of hourly rounding in the acute care setting, the hospital should see a decrease in patient falls. If implemented and complied with correctly, results should be close, if not 50% reduction of falls. If we can get a grip of the fall situation among healthcare facilities, then we will be able to grasp the meaning of patient safety culture. In compliance with this evidence-based initiative, this will allow myself and other staff members to promote better patient outcomes by reducing falls. This will create a culture of patient safety by predicting patients' needs in hopes of preventing harm. And these are my references. And that's it.
Good job.
You don't have any questions?
Wow. You know our floor is stopped doing papers.
No, I didn't today. Why?
Lori told me that she thinks it's ineffective.
It is.
She says that no one's doing it. She says when she looks over it, all the numbers are the same. She's like, how can someone be in the room at 2 o'clock in the morning now? So we stopped doing it. It's an orange.
See, at least I was smart enough to switch the